Minnesota could lose millions in federal public health funding, but state leaders say they still haven't been told why, and they say they were given no warning.
We have team coverage tonight as we dig deeper for you. Investigative reporter Ryan Raish breaks down a letter sent from the CDC. First, Maria Bray asked the Minnesota Department of Health Commissioner why it happened and what's next.
This involves a public health infrastructure grant that's given to states on a 5-year basis. But Minnesota and these other states are at risk of that money being snatched away. And here in Minnesota, that's about $38 million. And the Department of Health says they're doing everything right.
Anytime resources are taken away from communities and who are already struggling to have their needs met, that can be very scary for people.
Jenna Carter with the Epilepsy Foundation of Minnesota says that's the reality for people with health challenges who depend on programs funded through the Public Health Infrastructure Grant.
Particularly those who live with chronic conditions like epilepsy, really can be left without the critical care and support that they need to live their best lives possible.
MDH Commissioner Brooke Cunningham.
This is causing a lot of chaos and uncertainty.
Says they're fighting to keep millions intact after the CDC says it's canceled.
They're saying in their reason to terminate these grants that we are not in accordance or in line with federal administration priorities. That is a bit perplexing given that our work plans were approved. We had already been allocated these funds.
So they laid out their priorities, but they didn't say you're not doing this specific one.
Oh, no, they did not do that. They just said these are not aligned with our priorities.
The CDC says its priorities now center on strengthening the public health workforce, labs, data systems, and health threat detection.
But if they tell you, if they point out some things that aren't aligned, would there be some possible changes if there is something that they're saying isn't being?
I would love to see that, given our work plans have been approved and already considered to be aligned with their priorities. Certainly, we will defend our work. We will defend our work for Minnesota.
She says Minnesota is relying on a temporary restraining order to keep access of that money until a judge makes a decision on what happens next. I'm Maria Bray, 5 Eyewitness News.
And as you just saw there, 4 Democratic-led states are seeing public health funds canceled. Altogether, Minnesota, California, Colorado, and Illinois are losing $600 million. 107 health departments in all 50 states received those grants. So what is behind the abrupt decision to cancel the public health funding?
Investigative reporter Ryan Raish is digging into how it all played out. He continues our team coverage right now.
This tug-of-war between the federal government and the state is now escalating in court, and the tone here is already shifting. I want to show you this new statement 5 Investigates obtained from the U.S. Health and Human Services. A spokesperson saying these federal grants, quote, were temporarily paused so HHS could implement a new review process, one that will ensure funds are used for their intended purposes and in alignment with agency priorities. But that is very different than how it started. Here's the initial letter from the CDC. It says right off the bat, funding is hereby terminated effective February 11th. Without saying what the state is doing wrong, the CDC lists out the administration's priorities. You can see them on your screen right now. Gold standard science, global leadership, rebuilding trust, just to name a few. The CDC goes on to say in that letter that, quote, no corrective action is possible here since no corrective action could align the award with the current agency priorities. As you just heard, Minnesota joined a lawsuit with other states impacted by this decision, arguing that they were singled out for political reasons. A judge issued a temporary restraining order blocking the Fed's decision for now. We'll see how this plays out. In the newsroom, Ryan Raish, 5 Eyewitness News.